A 25-year-old woman comes to the emergency department with shortness of breath. She finished a weeks-long road trip with her friends a few days ago, after which she experienced pain in her calves. A pulmonary angiography confirms the diagnosis. She has a history of several similar episodes of calf pain. Her father also had a history of problems with clotting. Which of the following is most likely to be related to this patient's condition? Choice A, antithrombin 3. Choice B, protein C. Choice C, platelet factor 4. Choice D, D-dimer. Or choice E, antiphospholipid antibodies. I'll wait 5 seconds and answer the question. So this patient obviously has a pulmonary embolism, very classic presentation, where the patient was sitting for a long period of time on a road trip. Then they get really bad leg pain. They might go massage it or something, and then they come back and they'll have shortness of breath, and they get an angiography and it shows the embolist, when sometimes it's a saddle embolist. But of course, now I tell you that there is a history of several episodes of this. So she has some kind of clotting problems, some kind of hypercoagulability disorder. And I also tell you that there's a genetic factor here because her father also had similar problems. So you just need to know that the most common inherited hypercoagulability disorder is factor V Leiden, which is where you have a mutated factor V that doesn't properly get broken down by protein C normally. So that's why choice B, protein C, is the correct answer. Now, as far as this question goes, because the answer choice is a little bit vague here, you could also argue it's protein CNS deficiency. That can also have similar findings. But that's a lot rarer than factor V Leiden, and that's one of the things I want you to take away from this, is that you do want to know that factor V Leiden is the most common inherited hypercoagulability disorder, because there have been questions where they just give you some kind of patient that has recurrent DVTs or something, and then they'll list a bunch of hypercoagulability disorder, and you have to pick what the most likely one is, and it's probably going to be factor V Leiden. That's the most common one, like I said. So let's look at some of these other answer choices here, because they are also quite important for you to understand. Choice A, antithrombin 3. Obviously, as the name implies, antithrombin 3 helps to break down clots. There is such a thing as antithrombin 3 deficiency, but it is quite rare, at least much rarer than factor V Leiden, so not the best answer choice in that sense. The other thing you want to know, that antithrombin 3 deficiency can be acquired, so just a lot of different conditions like DIC, sepsis can all cause this, but one in particular that I think they really like bringing up is in nephrotic syndrome, because they do like you to know that a nephrotic syndrome patient is technically in a hypercoagulable state because they're basically peeing out all their antithrombin 3. That's basically what's happening. So that's just like one of those little things you want to be aware of. Choice C, platelet factor 4. This is referring to heparin-induced thrombocytopenia. Now, technically, there's two types of HIT. The first one is asymptomatic because it's pretty much just heparin doing its job, and you'll have a decrease in platelet count after using heparin. Usually, like I said, it's asymptomatic and platelet levels will normalize within a couple days. But of course, the one you do want to be more aware of is type 2 heparin-induced thrombocytopenia, which is where heparin will bind to platelet factor 4. IgG will recognize this complex, and then these complexes will bind to platelets and activate the platelets. So what you end up having is that you'll use up a lot of your platelets, you'll have a thrombocytopenia, but you're also clotting at the same time. But it's the clotting that's a real problem, right? Because it's going to cause all kinds of problems around the body. Now, of course, as far as this question goes, it's really not relevant because nothing here suggests that she's taking heparin, and she doesn't seem to have any conditions which would necessitate heparin. That's one way to hide the question, sort of, is to give you a condition where you would want to use heparin. But there's nothing like that going on here, so not a good answer choice. Choice D, D-dimer. This is just a distractor. D-dimer is just a breakdown product of fibrin. Now, in this patient, D-dimer is probably up because she has increased clot formation and therefore probably also increased clot breakdown. So she would probably have high D-dimer, but it's irrelevant to her condition. Choice C, antiphospholipid antibodies. Now, of course, antiphospholipid syndrome, you might be thinking that because this is a young woman, so you might be thinking like lupus or Sjogren's or RA. If I didn't make the mention of her having a father that also had clotting problems, this would be a very enticing answer choice, but of course, antiphospholipid syndrome is not hereditary. But of course, you do want to know what this looks like, and usually they'll say something like patient has had recurrent miscarriages and that sort of thing. So bring it back. You just want to know that factor V Leiden is the most common hypercoagulable disorder, and you do want to remember your basic physiology for the clotting cascade. You do want to know what protein CNS does. You want to know what factor V does. And that should be about it. Hope you found this video helpful. See you in the next one.